All for joining us today. We'll get started in just a moment. Want to make sure everybody has a chance to get in the room before we begin. You will see on this slide to please go ahead and type your name and your affiliation in the chat so we know who you are if you want to share it with us. And we will ask questions and pause throughout, but mostly save the questions for the end. But please feel free to ask them at any point in the chat box, and I will collect them all and ask what we can. Thank you so much for joining us today. Also want to let you know that you will be getting the link in a thank you email with the recording and the slides and any resources that we share today. So you will be getting all of that. And we thank you so much for joining us today. And it looks like we've got a nice representation from around the country. So glad you could join us today. Well, without a moment's ado, we will get started. And again, you will be getting these slides within the next day or so. So, Ro, if you will turn it to the next slide, I will let you all know that I am Ana Beltran. I'm the director of the Grand Families and Kinship Support Network at Generations United. And we are the first federally funded technical assistance center on grand families and kinship families. And by that, we mean grandparents, other relatives, and close family friends who raise children when parents can't. So really the array of victim kin and blood-related kin. We don't help the families directly, but what we seek to do is help those agencies that you see in that umbrella. So it's child welfare along with a bunch of others that touch the families and support the families. And we try to elevate things like what we're going to elevate today. And I'm so pleased to be part of this today and rolling out the kin-specific foster home approval standards for you all. If you turn to the next slide, Ro, I will share that just a few things that we do at the Technical Assistance Center. And several of the panelists are members of our network. NICWA, the National Indian Child Welfare Association, is a partner. Marina Nitsa and Heidi Redlich-Epstein are subject matter experts with us, and good partners like Stephen Olander. So you will hear from all of us today, and so pleased that they could join us. You'll see that we respond to individual requests for help. We have these webinars. We have lots of resources on our website, so please visit it. Next slide, please. Today, we are going to just go over the basics of the final rule, and hopefully you were able to log into the ACF webinar, the Administration for Children and Families webinar at 2 o'clock today, a couple of hours ago today. I will not belabor that because we really want to get into the kin-specific approval standards that we are rolling out today, and we're so thrilled to be rolling it out to give you the tools to implement the final rule. And we will touch on next steps and then I'll leave some time for questions. Next slide, please. So the final rule, what is it? Next slide, please. You will see a link here that takes you directly to the final rule. So 3 rules were rolled out at the same time. The other 2 are proposed. This is a final rule. So this is it now. This is a regulation. And all Title IV-E child welfare agencies now have the option to implement kin-specific foster care licensing or approval standards. So for a long time, there's been an interpretation of a regulation that said, that was interpreted to mean that you could not have kin-specific licensing standards or a separate licensing standards or different licensing standards or whatever you want to call it. You had to have one set as a state or tribe or territory that impacted both kin and non-kin, which made it hard for kin, right? Because kin didn't fit into this traditional setup. So federal law has long required that these Title IV-E agencies can create and maintain their own standards. And this rule does nothing to change that flexibility. It just basically says you can have a separate process, a separate set of standards for kin. And if you go to the next slide, Ro, you will see that all the standards that, we have elevated over the years, Heidi at the American Bar Association, who you're going to hear from in a minute, and we looked at all the licensing standards 10 years ago or so. And we saw an array of things like tuberculosis tests, like rabies vaccines for dogs, like you couldn't serve as a foster parent if you'd written a bad check 20 years ago. Those are all state standards. These are not federal standards. And the feds are really encouraging and saying strongly consider state, tribe, territory aligning with just the federal standards. Now, states have long had the power, and tribes and territories, Title 40 agencies, which are basically child welfare agencies that get federal money, have long had the power to waive some of those non-safety standards, but not all of them do, and it creates administrative burdens and just more hurdles for the families. So that can go away under this new scheme as well. Doesn't have to, it's an option, but it can. Next slide. So what does the rule actually say? It encourages, and in the information memorandum that Melissa is going to drop in the chat soon from the feds, they actually say strongly consider, state, tribe, territory, strongly consider establishing these kin-specific approval standards that are limited to the federal law requirements that have long been in place. And those federal requirements say, adhere to the Adam Walsh Act, do these criminal background checks, and then if you're a kin or a non-kin and you've been convicted of a violent felony, or you've been convicted of a battery or assault charge, or drug-related felony within the last 5 years, that's the second part, you cannot be a foster parent. That's all Adam Walsh says. It doesn't say, oh, I wrote a bad check 10 years ago, or, I unlawfully assembled, which we've seen in states, all kinds of things. Those are state agency creations. So adhere to that, and then adhere to reasonably be in accord with recommended standards of national organizations. And that is what we're going to roll out today and give you today so that you can align. Now, the second part of it is a requirement. This first part is an option, but the second part is a requirement. So as a Title 40 agency, as the Child Welfare Agency, you must pay fully licensed or approved, however you do it, kin and non-kin the same way. And within 4 months, and you'll see in the policy guidance that Melissa's going to drop in the chat that came out today from the feds, that you have 4 months to show that you're going to pay your non-kin and your kin the same amount. So that is a requirement. And that is basically what the final rule says. And we have resources we'll share at the end with you about the final rule. But now it is my privilege to turn it to a couple of states who are going to tell you about their excitement around this final rule. So, Ro, if you will play those videos, please. While he's gearing that up, I'll just let you know that it is 2 states that are just very excited. And then we're going to hear from 2 more states later on who are also equally excited. Here we go from Illinois.
My name is Julie Barbosa, and I'm the Chief Deputy Director for Strategy and Performance Execution at the Illinois Department of Children and Family Services. For 30 years, I've been dedicated to the work of child welfare in Illinois. My experience has reinforced the importance of keeping children connected to their families and other natural supports, especially when there are circumstances that create a need for them to be separated from their parents. Illinois has been a leader in prioritizing the placement of children with kin, as we know it reduces stress, anxiety, and uncertainty in an already very tumultuous time for a child. As part of the BH Consent Decree, Illinois has been working to increase child-specific licensure rates for kin to increase financial supports. Children can easily be lost in what others may think is best. As a leader in the child welfare space, Illinois DCFS reminds you to think of us as we work to assist our kin and, most importantly, our children during one of the most difficult times in their lives. Thank you for the opportunity to participate.
And now we are going to hear from Washington State, and a longtime supporter of all things kin, I didn't quite pronounce that correctly, Ross Hunter. So Ro, if you will play that for us.
Hi, I'm Ross Hunter, the Secretary of the Washington State Department of Children, Youth, and Families. I'm proud to say that Washington has been a leader in the kinship space. As of the beginning of October, 58% of Washington State foster children are placed with kinship caregivers. We've been providing kinship caregivers the same level of financial assistance we provide to non-kin foster placements through a complex set of waivers, and are excited that the new rule will allow us to do this more simply, more reliably, and much more quickly. We will work with stakeholders, kinship caregivers, and tribal partners to implement the new kinship licensing rules. In July, we also launched an initial license for kinship caregivers. This allows financial support with state money on day one of a placement. DCYF believes kinship caregivers are the best option when a child or youth cannot live with their parents, and we remain committed to building a strong kin-first culture at our agency. Thank you.
Thank you, Mr. Hunter. Now it's my privilege to turn things over to my longtime partner in all things licensing, Heidi Redlich-Epstein.
Thank you, Lana. So it's my honor to be able to kind of launch and roll out the wonderful kinship licensing standards or approval standards that we've been working on for some time since we first heard about this new rule and have really been thinking about even longer. So if you can give me the next slide, please, Ruth. So as Anna mentioned, that federal law requires that we have standards, that states have standards that are reasonably in accord with recommended standards of national organizations. It's required by federal law. But to date, there really have been no kin-specific national standards. So we're excited to bring to you our very first version of the kin-specific foster home approval standards, recommended standards of national organizations. Next slide, please. So a group of national nonprofit partners got together. Here you see a list of kind of a who's who of kinship in the space right now, of people who brought our thoughts together about what really would kin-specific standards look like. And so we have the national organization that brought these in with the thought of really respecting the unique needs of kin caregivers, removing historic barriers, and striving to make the approval process easier and more flexible for kin caregivers. But we didn't just stop there because we didn't really want to assume that we knew everything. So under Marina Nitz's leadership, we undertook a very kind of a deep dive into talking to kin caregivers, subject matter experts, and we were very happy to have 45 Title IV agencies who voluntarily provided information to help kind of inform these set of licensing standards by sharing with us their current process for licensing or approving kin. And we found it really helpful to kind of think about that and look at what they're currently doing. We used all of this background intelligence and the already existing NARA model family foster home standards to develop these model standards and an implementation guidance. And so you're going to hear a little bit more about that today. We're really excited to be able to kick that off. And I'm going to turn it over to David Simmons from the National Indian Child Welfare Association to tell us a little bit about tribal perspective on this.
Great. Next slide, please. Well, I'm really excited about being able to be here too. And the National Indian Child Welfare Association has worked with a number of these partners and others for years on trying to promote improved standards for licensing and approval. But one of the things that we do when we come into partnerships like this as an organization is that we always recognize that tribal nations are sovereign nations, and they have their own sovereign powers to be able to develop their own licensing standards. In fact, the Indian Child Welfare Act goes as far as to say that when a tribe licenses or approves a home, that's equivalent to when a state licenses or approves a home too. So in the development of these standards, as exciting as they are, and I think they have some applicability also, or some ways to inform tribes who are working on their own standards, these were not designed specifically for tribes. In other words, if you're working on as a tribe your own standards. These are not necessarily designed for the diversity of tribes and the culture, and also the different kinds of program designs in child welfare that are out there. So the new rule is not applicable to tribes specifically that don't operate a Title IV-E program. And many tribes, about half of the tribes in the United States operate a 4E program through either an agreement with their state or on their own through federal direct application. But one last thing I would say too is in the development of these, we know that there are lots of Native children in state child welfare systems all across the country. And we're very hopeful that if states look at this, they'll also be thinking about how to partner with their tribal partners to create and use this kind of information to help create better kinship rules that will support them too. Okay, thank you. I'm all done. Who should I turn it back over to? Anna?
Thank you, David. Appreciate it so much. And appreciate your partnership. We're going to turn it now to, who am I turning to Marina.
Thanks, Anna. Perfect. Hey, everybody. So extremely excited to share more with you about kind of the nitty-gritty of the model standards. As Heidi shared earlier, we are leaning into the federal recommendation that a kin process does not go beyond the minimum federal requirements. So as Anna said, things like rabies vaccines and tuberculosis tests, those were never federal requirements. Those were from states. And so they are explicitly not in these kin-specific recommendations. So we focused on federal requirements. And I mean, this could not have happened without the incredible generosity and collaboration of so many people, as I've seen in the panelist or the attendee list that joined in the user research here. So we talked with kinship caregivers, with subject matter experts, and spent a lot of time, hours with 45 Title IV agencies, understanding the nitty-gritty nuances of your background check processes, of your safety needs assessments, of your emergency placement processes. And we pulled all of that together into what I sort of refer to as like a lovable Frankenstein's monster of the best of ways to serve kin from around the country. And we look forward to continually refining that together. And so that is what forms the basis of the recommended standards of national organizations. Next slide, please, Ro. So the new kin-specific recommended standards are the background checks that you are already doing, a caregiver suitability assessment, which you are already doing at an emergency placement. And that means, grandma is, perhaps elderly and has some challenges and we have to place triplet 3-year-olds. Maybe we need to think about how we might be able to support that placement. That this does not mean medical exams. This does not mean tuberculosis tests. And then a safety needs assessment, which you all already do, right? You already do a walkthrough of the home. And we took every existing safety needs assessment that we could find. And again, we put them together. We pulled the best bits from all the different ones. And then we tested it. We went back to 45 agencies, to the workers that are conducting these assessments, and said, hey, try this out. Where are you stumbling? How might this be easier? A quick example is people repeatedly reported that the word combustible, they didn't know what that meant. So we took the word out and replaced it with flammable, which more clearly understood. And then we took that assessment to the actual homes of kinship caregivers and made sure that it worked in apartment buildings, on native lands, in mobile homes, on farms, and that there were edge cases that helped get kin to yes, instead of finding ways to disqualify them. That is it in terms of what the kin-specific model standards include. So Ro, if you go to the next slide, we did not forget about these other things. We intentionally are not including them. Medical exams, financial reviews, pet registration, vehicle registration, tuberculosis tests, misdemeanor crimes from 20 years ago, not having enough bedrooms. Those are all explicitly not in these standards because they are barriers to placing kids with kin, and they are barriers to supporting kin. And we want to stop that. So they are not included by design. We did not miss them. Next slide, please, Ro. And something we also really heard as we talked to so many of you was that you wanted implementation guidance. How do you help get to yes for kin, and how do you help support them? So again, we took policies and practices for many agencies that are happening today and included them in implementation guidance as part of the model standards, ways to exercise flexibility with kin, help meet the unique needs that a particular kinship caregiver may have with a particular child, really encourage and focus on providing material goods and support so that instead of saying no, or instead of placing a child with kin but not approving them, getting them whatever they need to get over that chasm so that placement is approval. And communicating with transparency. Boy, did we hear stories from kinship caregivers and from the workers that were working with them about situations where people were scared. They were confused about next steps. It's a very overwhelming process, as we all know, for many people in this experience. And there are many ways that you can take concrete steps to make the process less stressful, more clear, and more transparent. So we included that. And then we also included example forms. It is not a requirement that you use them, but we had a lot of agencies say, hey, it'd be great if you could give us a safety and needs assessment template. And so we have included that. We've included an example form for evaluating background check results according to our original NARA evaluation standards, for requesting background check information from kinship caregivers in a way that's slightly less stressful. And we really look forward to piloting these forms in a few agencies first and making further refinements as we see them out in the field. And with that, I am happy to pass it over to Stephen.
Hi there. I'm Stephen Olander. I'm the Senior Director for Strategic Policy Initiatives at Think of Us. I'll be talking a little bit today about the benefits of the rules and some next steps for that. If we can go to next slide. So I am really excited about this new rule, and I hope that everyone here is too. Most importantly, this rule will mean that more children will get to be placed with the people who know them and love them. And that's so important because, as we know, we have decades and decades of research showing that children do better on almost every measure when they are placed with kin, especially when those kin are, when they're placed with kin who are supported. So most importantly, we'll see that. It will also mean that those kin caregivers are given equitable support, which is especially important as we know that kin caregivers are disproportionately Black, Indigenous, and living in underserved rural areas. For child welfare agencies, this is really important because it'll expedite the timeframe for states and for Title IV tribes to get federal reimbursement for those placements. And it'll maximize the amount of federal funding that those agencies are able to draw down for kin caregivers, which is especially important, we know, for the child welfare agencies that currently use their own funds to pay either full or partial foster care maintenance payments to kin. For just a sense of scale about that, it was estimated in the proposed rule that this would lead to about $3 billion of increased federal spending over the next 10 years. So it's a pretty substantial maximization of federal funding for this. It'll also make it easier for children to exit to Title IV guardianship. We know, we've heard from many jurisdictions that have difficulty utilizing Title IV guardianship assistance program because of the requirement that kin caregivers be licensed for 6 months before the child could exit to guardianship. This will start that clock sooner so that guardianship decisions are being made based on when it's appropriate for the well-being of the child and of the family, and not based on when that child is able to meet some non-safety licensure requirements. And it'll greatly reduce the administrative burden of kin licensure for both families and for the child welfare workforce. If we can go to the next slide, Rob. Thank you. This is really important because under the current paradigm, there is a lot of red tape around kin licensure. Child welfare agencies, as Anna mentioned, are able to waive non-safety requirements for kin, but they have to do that on a case-by-case basis, which is just another bureaucratic burden that's on top of an already really overtaxed workforce. And in general, helping kin meet requirements that were not designed for them is a burden on agencies and on staff. Agencies that we spoke to through this process estimated that it costs between $5,000 and $10,000 to license a single kinship family. And taken together, those two things mean that it's just more difficult for agencies to place children with kin. And that is the opposite of what we want. This rule, if implemented correctly, can erase that burden. And that'll allow the child welfare agencies to refocus the workforce on priorities that are actually related to child well-being instead of to unnecessary bureaucracy that doesn't impact the safety or well-being of children. Things like caseworker visits, timely referrals, or frankly, for the workforce, getting a chance to breathe. That'll also mean that these caseworkers will be doing more of the work that they were called to do, the work of helping children and families, instead of spending more and more of their time on paperwork, which will help with morale and staff retention. It'll also allow agencies to focus their financial resources, some of that $5,000 to $10,000 that agencies spoke of, on other priorities, like on prevention, further support for kin caregivers, recruitment and retention of foster families, coordination of community-based mental health services, co-creation of policies and practices with communities that are impacted by child welfare. It'll also help to streamline the ICPC process. Anita Kelly put a question about this in the chat. This could definitely impact ICPC, especially if Title IV agencies stick to what is in the recommended standards. The more that we are able to align the licensure requirements in different jurisdictions, the more we can smooth out the process for interstate placements, and the more we will be able to remove some of those difficulties and bureaucratic burdens around ICPC. And importantly, this will also hopefully lead agencies to re-examine the impact of some of the unnecessary barriers that are created by their licensure requirements for non-kin. Recycling requirements, tuberculosis testing, all of these things that are making difficulties for caregivers, whether they are kin caregivers or not kin caregivers, but aren't adding necessarily to the safety of children. So can we go to the next slide, Ro? So we'll talk about next steps. We can go to next slide again. So when we spoke to child welfare agencies, we heard overwhelming support for this new option and excitement from agencies to move forward with it. So when this rule goes into effect, we'll be working with 6 jurisdictions, 5 states and 1 Title IV tribe, to pilot the standards for and this new rule. In doing so, we'll be doing some of the work of trying to make sure that we're doing this right, where we'll discover any and troubleshoot any unexpected challenges. We'll use this time to identify any potential unintended issues that pop up, because we know that even the best policies have downstream impacts that we can recognize and that we can address. And lastly, in doing this, we'll create tools, lessons learned, refine the tools that we already have created to help support agencies as they take up these rules and smooth this process as we go forward. You can sign up using the links that are here and that have been just placed into the chat to get more information about this. Also, please look to the standards that we have and go through the forms to provide feedback, because any feedback will inform any revisions that we have here. These standards are meant to be a living document, as we know that policy grows and changes, and there will be revisions. My hope is that we'll soon be at a point where every state and every Title IV tribe is taking up these common sense rules, and we're able to place more children with kin and have those kin supported. So for right now, I'm going to turn it over to Sixto Cancel, who is going to speak a little bit about the impact that this rule will have on youth.
Thank you so much, Stephen. And for everyone, hi, my name is Sixto Cancel, the CEO and founder of Think of Us. And I thought I would just kick us off with just reading a quote from one of our young people who ended up aging out. And this young person said, "All I ever wanted was for a family. But I was told I was too old and I was kept in a group home until I aged out. I wasn't given enough necessary things or resources to survive once I got out. And I got kicked out of my program for not being productive because I lost the will to live, because I didn't know what I wanted to do with my life now that it was my own." And I wanted to start there because what these rules are is the first step to be able to go ahead and make sure that this is not the story that young people tell us over and over and over. And I want to pause here to also say, like, not only is this a special moment because we can change that narrative, but because what these rules, these national standards represent is the moment that the community has really come together. I think this is probably the biggest co-designed project that has happened across the country, where 45 states have, given input to these national standards, where you had 100 caregivers be able to inform it. So I'm just going to be bold and put that out there. That's not something that I have done the research on, but I'm just going to go ahead and just claim it anyway, that this group has really pushed forward in such a way that's so powerful for co-designing, and it has and has pulled together so many resources from so many different organizations to be able to get to this point. I want to say that for us, I think of us, this is important, work. And for me personally, this hits home. When I was 15 years old, I had met my brother and my older brother, and he had moved from Puerto Rico to Connecticut, where I grew up. And immediately, once he found out that myself and my younger brother were in foster care, he wanted to start the process to be able to become a foster parent and get us. He couldn't do that with all of the barriers of, as a 19-year-old, trying to figure out how to make enough money for the deposit on the apartment. All of the things that were, a barrier came up, the very things that we heard in these interviews. Unfortunately, he had to move back, to Puerto Rico, and ended up losing his life to gun violence that was there. And there's a piece of me that truly just believes that if there was this process where we had a kin-specific process, he would have, not only would he have been alive today, but we would have lived with family. And for me, I know that that was the moment that I gave up on the idea of family and started to prepare to age out. That was the last straw for me. So when I think about these national standards, it's easy to get into the weeds and say, well, we always used to do the tuberculosis test and we always used to do this. But in this very moment, I think lifting up is the power of actually keeping families together. And I'm so excited to be part of the crew that's going to be supporting those first 5 states and implementing these standards and iterating with them. And what I'm most proud of in this moment is that this is the representation of so many folks who have contributed. People are burdened all the time with just their day job, and then to be able to say, hey, I'm going to make time to give feedback. I'm going to make time to get on the phone and talk about these things. It cannot be underestimated. And so from, Think of Us and the others who have been part of this journey, just a huge thank you to everyone who has contributed to this. The 45 agencies, the 100+ kin caregivers, the young people that this will impact. This is something that, we're holding dear to our heart. And we're excited to be relentless about supporting the implementation to make sure that we get this right.
Thank you, Sixto. Now we will hear from 2 more states who will tell you about their excitement for the rule. And
while we're waiting for the video, I'd like to thank both of you, Sixto and Stephen, and everyone on the panel. Thank you so much. It's been a great partnership.
Hi, I'm Tricia Howell. I'm the Child Welfare Director in Oklahoma. And Oklahoma is really excited to be on the front end, one of the first states to roll out the new kinship approval process. For the last several years, we've tried to put several kind of flexibilities in place so that we could do a better job supporting kin, including we put startup stipends and training stipends to help the families while they're in the approval process. The new standards are going to help us be able to support those families better. We know that kids have better outcomes when they're placed with family or kin, and they achieve permanency more quickly. They're more stable. They endure much less trauma when they get to stay with people that they know. So this is a big priority for Oklahoma, and we're really excited to be able to be part of this rollout.
And then our final video is from Michigan, right, Stephen?
that is correct.
And they are very excited as well.
Hello, I'm Demetrius Starling, and I'm the Senior Deputy Director for the Children's Services Administration in Michigan. Michigan is absolutely thrilled over the recent federal rule change, which paves the way for a distinct pathway for relative approval and is a positive step forward in supporting kin caregivers and ensuring better outcomes for children in their care. The state of Michigan has consistently demonstrated its commitment to reducing barriers within the kin caregiver licensing process. In fact, As early as 2019, Michigan took the initiative to allocate state funds, ensuring financial support for all kin caregivers from the very first day a child is placed under their care. We understand the importance of placing children with family, and currently we place approximately 50% of our children with kin caregivers. We believe that this reflects Michigan's recognition of the value and importance of kinship care. We are especially excited about the potential impact a separate approval path will have for kinship care, as it promises to enhance permanency outcomes through an increase in subsidized guardianship placements. Michigan is eagerly looking forward to the opportunity to become one of the first agencies to implement a kin-specific licensing process, which we believe demonstrates the state's commitment to best practices in kinship care.
Thank you so much, Stephen, everyone, and turning it over to Heidi now.
Thanks, Anna. So now we're going to talk a little bit about some of the practical applications, things that need to be done. As we know, simply adopting standards and changing your standards is not going to be enough. You need to put in place certain processes and policy improvements that are going to support the effective implementation, because we really want to reach that goal of increasing the number of children who can live safely with people who know and love them, and to make sure that we're supporting those families in every way possible. So here are just a few examples of things that we recommend be put in place in order to support the adoption of these standards in a way to make sure that they're effectively implemented. Fingerprinting. Fingerprinting came up as sort of one of the number one problems. Now, as Marina mentioned and Anna mentioned, we need to make sure that the criminal background checks are done. But from doing that sort of scan of the states, we found that there are some states who are doing a phenomenal job and have some really good practices in place. Things like using live scan machines where they can actually go and take their fingerprint in the house of the kin caregiver instead of making them go somewhere, or sending them to places like their local UPS stores, and making sure that fingerprinting and the process of fingerprinting itself is not a barrier to being able to adhere to these standards and get the kin approved or licensed as soon as possible. The other big area that we heard a lot about were these out-of-state background checks. So if a kin caregiver has lived in another state within a certain number of years, 5 years, they have to do these out-of-state background checks. Well, some of those background check processes that are in place right now are really onerous. And for those of you who are doing this work in the field, who are on the call, I think you know what I am talking about. Things like you have to use a certain color ink, you have to get it notarized, charging fees. So we are really asking you to look at sort of those nuts and bolts, not just, again, the standards, but the nuts and bolts of what needs to be in place to support the adoption of these standards so that we make sure that they're happening. And then finally, looking at your definition of relative kin. And yes, the federal government is not going to tell you that you need to have an inclusive definition. We were thrilled that the final rule encouraged Title 40 agencies to have a more inclusive definition of relative kin, but making sure that you are broadly looking at those individuals who are not just related by blood marriage, but also tribal custom, have emotionally significant relationship to the child's parents or other family members. So really making sure that you're looking at all of these components and more when you're putting these standards in place. I don't want to belabor it, but knowing that the standards themselves will not be enough, but really making sure we have those in place. Next slide. So what can you do? What are we going to do from here? First thing we ask that you do is please read the standards. And I did see in the chat that some folks have trouble with the Google Drive. We'll make sure we get them to you. Read the standards. Tell us what you think. Provide comments. Provide feedback. Again, although we have really kind of painted with a broad brush to try to make sure we've included lots of perspectives, we want to hear from you. And if you are kind of seeing a barrier or a problem, we want to be able to help with that. So reach out for assistance, whether that's to one of these organizations that help to write the standards, to your federal officer in your region. But everybody here on this webinar is available to help you brainstorm through those problems. Again, I think you really want to get to the yes, not the no. What can we do to help? We are all here to help states. We are all, as you can tell, I'm sure, are very excited that this is finally happening. But because it's optional, there is a fear that it will not happen in every state, and that we will only see barriers to having it be implemented properly. We want to help you get over those barriers. So that's really the next thing that we ask you to do, is reach out if you need help. All right. And I think I'm turning it back over to Anna.
Thank you. And we now have time for questions, and I have a long, nice, wonderful list from the chat, and really appreciate your engagement. I'm going to throw out the first one to you, Marina. Is there any state that's already in alignment with this new federal rule? And if so, what are they doing? Have they increased their overall number of kinship placements? And are there any challenges or implications that they have seen?
That is a slightly complicated question. A lot of states are extremely close with your current kinship emergency placement processes. In fact, having interviewed 46 of you directly, your emergency placement processes are almost exactly aligned with the new kin-specific model standards, with the small exception that a few agencies do not fingerprint for emergency placements, only if the kin caregiver eventually moves on to licensure. In places where that barrier is higher, like where emergency placements are not allowed for extended definitions of kin, or where licensure is required for kin in a certain number of days, we have definitely seen drop-offs on the number of kin placements. We are extremely excited during the pilot agencies to capture this data more crisply, so that everybody else can lean on that data in their own work.
Thank you, Marina. Heidi, do kinship caregivers have to complete pre-service training, such as MAP or IMPACT or anything?
So under our new set of standards, that those kinds of requirements are not needed to be licensed or approved, and certainly not needed for placement. So things like MAP and training is something that we recommend be offered to kin, and because we heard from a lot of kin, they like the training, but be offered to kin after they're licensed or approved, and not just be a barrier to that license or approval.
Thank you, Heidi. This one is a little bit more complicated and specific. It's from Ohio, and I believe it's saying the Social Security Administration requires a foster parent receive training on the reasonable and prudent parent standard. And as part of Ohio's waivers, we clarify that this training for kin can occur after licensure. How will this look for creating a separate process for kin licensure? And Heidi, if you could take that one as well.
Sure. It's kind of the same answer in that, yes, there's a requirement for the reasonable and prudent parenting standard be adhered to, that people understand what that means. So training around that is certainly very useful. But again, much like Ohio pointed out, there's no reason that training can't happen after licensing and approval.
Thank you, Heidi. We have a comment in the chat about getting around some of that apple doesn't fall far from the tree beliefs. And I'd ask Melissa, would you drop in the chat? We have Tara, we have a resource on how children thrive with kin, and it summarized the decades of research that show that that is truly a myth, and that there is just so many benefits for children staying with kin. So hopefully that resource will help you change some hearts and minds. Stephen, this one's for you. There are big questions about having opposite gender siblings sharing a bedroom space. Best practice would state that they should have different bedrooms because of age, child development, etc. Is there guidance on this in the kin-specific standards?
So we want, and Marina, please also feel free to jump in on any of this. We want in the standards, for every family, they should be addressed on a case-by-case basis to meet the unique needs of children here. So what we want is to make sure that children are placed, and the idea is, assuming something is safe, place the child there, and then we can work from there to solve any problems that we have. If we want to try to help families get to a place where they have an extra bedroom, these are things that the agency can work with moving forward. But I don't know anyone necessarily who would say that we would rather see children separated or placed with strangers rather than being placed with their siblings if they have to share a room. These are things that we should work through. And so our standards provide a number of different implementation guidance that talks and touches on a number of these issues, but all based around the idea of assess for safety, assess for appropriateness of a placement, and then any other things that we want to add on top of that should be added as a support that is given to families, rather than a requirement that might prevent children from being placed with the people who know and love them.
Thank you, Stephen. Marina, we've got questions. I'm not sure if you're allowed to say, but the 5 jurisdictions that are going to pilot the kin-specific approval standards, can you share those names?
Yeah, there's 6. I think we can all appreciate states have different processes for being able to say out loud that they're doing something. So the 3 that have given me permission to say so are Illinois, Oklahoma, and Michigan. And there are 3 others. They know who they are, but I'm respecting that, there's some I's that have to be dotted before we can announce their names, unless they want to announce it in the chat, and they should feel free.
Thank you, Marina. We've gotten a couple of questions around the issue of, if the children are no longer in the custody of foster care system, and the kinship caregiver needs financial assistance, are they allowed to apply for kin-specific licensing? Can I throw that to you, Heidi?
Sure. Well, I would say that under the Family First Prevention and Services Act, there's a potential for getting voluntary or preventive services. It isn't quite the same as licensing as what we're talking about today, but there is a pathway to that licensing potentially. If you are coming to the attention of the Child Welfare Agency or call the Child Welfare Agency in need of assistance, and the child is considered at risk of entering foster care, there are services and supports that could be put in place, which could put you on the path to re-entering, or for the first time entering, having the child enter the foster care system and potentially become licensed or approved as a kin relative. I don't know if anybody wants to add to that, but that would sort of be my thought on that particular concept. And I know there are a lot of informal caregivers out there, and we're certainly not advocating, everyone come running into foster care. That is not the answer for everybody, and everybody has to make an individual decision with regard to the supports and services that they need and their desire to be involved in the child welfare system, or their desire to avoid the child welfare system. But I do think that the Family First Prevention Services Act kind of has a pathway to this.
Thank you, Heidi. And related to that, we got a question about, what is there going to be anything more done to help those kinship caregivers that are outside of the child welfare system and they are stepping in to avoid that placement? And the answer to that is that we're seeing movement at the federal level around improving temporary assistance for needy families. And we're also seeing states that are trying to create vehicles for additional support. So for example, DC has a grandparent and close relative subsidy program that can help families who are not child welfare system involved, where the kids are not in the legal custody of the state. We have seen other programs like that. Virginia has rolled out something. So reach out to us at the Technical Assistance Center and we can connect you with some of those examples that we're seeing around the country. This question is for Heidi. Can I ask you this one again? Which is, when we think of placement standards and requirements, are these laws that need to be changed at the state level? What do we need to do at the state level to make sure this final rule gets implemented?
Sure. And I'm going to give you my favorite lawyer answer. It depends. It depends on your state or Title IV agency. It depends where your current licensing or approval standards live. Are they statutes? Are they regulations? Are they policies? Every state's a little different in the way it's structured. So I think the first step in trying to understand how to take up these standards is to understand what you currently have in place and what would need to change. In some states, it might require legislative change. In some states, it might not. It might just be a policy or regulation. So it really kind of depends on where your current standards live. And again, we're really happy to help states that reach out to kind of figure that out. It is a little complicated because everything's written by lawyers, but we are happy to help.
Thank you, Heidi. We've gotten a question about ICWA, the Indian Child Welfare Act, and the final rule. I apologize, David, can you take that question? Because I don't see it, but I see.
Sure. So I think Samantha Powell is the one that asked the question, and she basically asked if ICWA will complicate the process. And my answer to that is no. In fact, this will probably help promote ICWA compliance and improve the ability to get those placement preferences under ICWA met. So this should actually be a real powerful tool for states that decide to develop their own separate licensing for relatives and kin.
Thank you, David. And Stephen, is there an age standard for a kin caregiver? Can an 18-year-old care for their sibling if they pass the other basic standards?
An 18-year-old can. There is not an age standard, and this is something that we've seen elsewhere. There is nothing in federal law that specifies age. But I will say part of what we are suggesting is that every caregiver should be assessed for their appropriateness, which doesn't mean that every 18-year-old is the right or appropriate placement for a child. But there are 18-year-olds who are parenting, and there are 18-year-olds who are parenting excellently and caring for people excellently. This is a way of saying that the Title IV licensure requirements should not be getting in the way of that. We should be looking at who the appropriate families are and how we can support those families so they can provide the care that children need.
Thank you, Stephen. And we've gotten several comments in the chat about the definition of relative and kin. Marino, can you take that one?
Yeah, absolutely. So, and it says this in the final rule guidance language itself. You can put your own definition of relative in, as long as it's in your state or your Title IV plan. That is what you can use for purposes of who is eligible for this kin-specific approval process. And we really want to encourage you to think extremely expansively about that definition. And we are recommending one that is by design very expansive. That doesn't mean that you can't still make prioritization decisions. It doesn't mean that you would pick a child's baseball coach over the grandma that they are extremely bonded with. Like, you can make prioritization decisions, but maybe a kiddo doesn't have a grandma and they only have their baseball coach, and they're very bonded with them. That's just a pre-existing emotional relationship that under our recommendations would qualify for the kin-specific approval process. We heard a lot of stories in states that have more restrictive emergency placement processes today about kiddos that have to wait hundreds of days to be with an adult that they know and love and trust, because they have to get through today's typical bureaucratic licensing process. And we want to see that hopefully go away with expansive definitions of relative for purposes of this kin-specific approval.
Thank you, Marina. And I've seen a few comments as well about, those caregivers that aren't, and there's so many more. We know that there are 18 children outside of foster care involvement with relatives and kin for every one child in the foster care system with relatives or kin. And we are definitely not forgetting about those 18 because it's a much larger population. This is a narrow, population in terms of the whole population of kinship families and grandfamilies. But we at the Technical Assistance Center and all those folks on the call really do have those informal caregivers in mind and are doing what we can to elevate. To the specific question about SNAP, there is no SNAP child only like there is temporary assistance for needy families child only. The only state that essentially has that is Minnesota, and it's through a waiver that they've long had. So there's work to do, and there are many people here that are looking to improve and the support that children and caregivers in these families have, because as we know, the children thrive, and that resource, the two resources, the one from NICWA and the one from Generations United, were shared in the chat. So I think that's about all we have time for questions right now, but I will, Melissa's going to share in the chat a way to contact us, and we will get those questions to the people who can answer them, or we will answer them ourselves. But please do reach out, because we are here to help and to connect you with people who can help. So if you go to the next slide, Ro, I'm just going to close this out with a few resources that hopefully will be helpful. Next slide, please. There's a long-standing website that the American Bar Association and Generations United in collaboration with Casey Family Programs has had, called grandfamilies.org. And we have created a new landing page there for all of the materials that are relevant to what we've talked about today, essentially. So please visit that. On the next slide, you will see that we have a website, the Technical Assistance Center that I told you about, the only federally funded Technical Assistance Center on grand families and kinship families, has a resource posted there that talks a little bit about the new federal rule. And the American Bar Association put out a complimentary piece. So read both of them, and hopefully they will help. Next slide, please. Also, I want to elevate that, you know, part of this is finding kin, right? And making sure that the children get placed with kin. And so what are these best practices and promising practices around finding those kin and making sure that they get the children placed with them? And so Marina Nitsa and her collaboration of many child welfare agencies has put out this kin finding toolkit, and we're proud to host it on our website. So please access that for very concrete tips on finding kin. And then finally, just thrilled to have had the opportunity to share with you all and to connect with you all. And please keep the questions coming. Please consider us a resource, and please answer the survey that we're going to post in the chat about how, if you found this webinar helpful and how we can continue to help. And you will be receiving an email in the next day or so with the PowerPoint slides, the recording, and all the resources that we've shared. So thank you so much for joining us. Thank you so much for being with us, all of our wonderful partners, the National Indian Child Welfare Association, the American Bar Association, Think of Us, the New America, I'm gonna trip up on it, but the Child Welfare Playbook, and Marina. So just a great group. And I noticed that the NARA was on this call, and they've been a key partner as well, and a Second Chance. So just really blessed to work with a lot of people. So please stay connected with us, sign up for our newsletter, answer our survey, and reach out in any way that we can help. So thank you so much. And we will, if anybody has anything to add, I can open it up because we've got a couple minutes. If any of the panelists would like to say anything, if not.
Anna,
Yeah.
for the questions that we did not have time to answer, I think we are still going to collect those through the chat, and when we have answers for them, we will post them. How do you envision, I'm sorry that I forgot to ask you this earlier, posting all the questions with some answers in
Yes. So so the questions that we're capturing in the chat, we will capture all of them. We will be answering them as part of the they're in the kin specific approval standards. At the end, there's an FAQ, so we will be adding to those. So you will hopefully benefit from all these wonderful questions that we have received today. So thanks, Heidi, for that question. All right, well, thank you all again. And Ro, I think you can close us out.